So my name is Elaine Shannon. What I'm doing is healthcare support. Well, it's very detailed, well put together course. It takes you through everything to do with becoming a healthcare support assistant out in the field, which would be in a nursing home, a hospital, or in the home care itself. So we learn about infection prevention and control. We learn how to make beds. We learn about palliative care, dealing with dying. We learn about intellectual disability, so dealing with adults and children with intellectual disabilities. So we also learned interview skills and basically everything we needed to be able to become healthcare assistants. But not only that, but to be able to write your CV, do an interview, worked on teamwork as well within the class, and just like every single thing was covered. And it didn't really hit me until I went out on work experience. We had to do 150 hours of work experience, and I was on the job and I was like, oh yeah, we've done this in class. Oh yeah, we've done that. We've done this. And so it was great. The interaction with the teachers and all the teachers that we had, for our course, we've had 4 different teachers. And every single one of them were just amazing. It's lovely, and they're so knowledgeable about their topics, and their knowledge was infectious, and you couldn't help but, become excited and want to know and want to ask them questions about their experience as well. So that was probably the main thing. And doing the work experience as well was great, being out and being with patients. In Dromahan, there's a care home there called Nazareth House, and it has gone through refurbishment in recent years, so it's expanded, and each patient has their own ensuite room, so it's kind of quite luxurious, really. And there were about, I think, 30 patients on every ward, and it was hard work, 12-hour shifts. That was a shock to the system. But it was just lovely, because in the beginning I didn't know any of the patients, but as the weeks went on, I got to know them and they got to know me, and they're like, Elaine, can you get me this? And I was like, oh, they know my name, and that was just so nice. And just touching, their hands and just, not all of their hands, but some of them liked it, and it was just lovely having that interaction with patients. Yeah, well, my next adventure, if you like, I've been luckily enough chosen to go on an Erasmus trip with the college. So I'm off to Braga in Portugal in a couple of weeks. So that's for 2 weeks. So I'll be doing work experience in Portugal in my chosen field of healthcare. So I'm really looking forward to that. And then I've got, before I go, I've got an interview for a job already with the HSE, working as a home care assistant. So fingers crossed I'll get that job and then do that. I would advise anyone to do the course for any age as well. Obviously I'm a little bit older, and I was a bit hesitant at first, thinking, oh, I'll probably be the oldest one. But when I got here, I quickly realized I wasn't. And nobody gave a hoot anyway, what age you were. Everyone was treated the same. And I think it's perfect as well for people who are, reached a crisis or reached a crossroads in their lives, and they think, what should I do next? Do a course. And it just already, because I've done this course, I've been given the opportunity to do an interview with the HSE, and that's kind of like the creme de la creme in healthcare assistant world, really. So and without that course I wouldn't been given that opportunity. So I would advise anyone to 100% go for it.